good afternoon, right? Is it morning, still morning? Okay, that's good. So, and it's just kind of early for me anyway. So just a couple of things I'm going to fix right quick before I get started. So one, I attended the Black AIDS Institute, African American HIV University. I didn't get a degree from there. It's not a degreed program, but it's probably one of the most important programs I've ever attended. My degree is in psychology, but I don't practice it. Probably never will. And the organization is the Afiya Center. And I'm going to have to fix my bio, because this is the second time I've heard somebody read it, and they talk about the work that we do with women, but our work is unapologetically around Black women. And so I don't like to... but that's one of the quirks when you grow and you get staff and then they start doing stuff for you, and I guess they think that after all these years I was mistaken what it was that I was saying, or I was mistaken what it is that I was doing. And I guess they figure, that it's just a little bit more politically correct, but clearly they didn't know me because I've never been politically correct. So we're gonna have to fix that. So I have two things. So I got those things out of the way. One, as you see, I don't have PowerPoints. I'm old, and I don't do well with PowerPoint. I get lost in my thinking. And so I have to write stuff down. And two, I was trying to be cute for y'all, and I had on shoes and stuff, but I had to find my comfort space, so I got my Chucks back on. I hope that's okay. So we're going to talk about listening to Black mothers. And it's interesting. I've been doing this work a long time. The Afiya Center started in 2000. 2008 is when we hung up our sign and said we are now an organization. But I left corporate America in 2000, really like 1999, 2000, 2001, somewhere there, to do work around HIV, actually, because I had a whole community of folk who I loved greatly who were gone. And so I continued through the 80s to make bedside promises, like I'm going to do something. Y'all not going to have to keep dying in shame like this. You're not going to have to, this is not going to have to keep happening. I'm going to do something. But life happens, and of course I had children, and I didn't have an ideal marriage. And so I had to take care of my family, my children. So when my youngest child got 16, when she turned 16, 17, and I knew that her college was secure, I left corporate America to dedicate my life to ending this epidemic in whatever way that I feel like I could do it. And so I started out to do this work around, it was going to be with Black gay men, as a matter of fact. I always tell people when I started this work, it's cute now, but we know we wasn't saying gay men back then. But I get to say that now, so when I tell my story, I get to say gay and not what it was that we used to say. And so I started this, and I found out that something was happening. Nobody was talking about Black women. I found out by coincidence or by accident that Black women were dying, that this was happening to Black women. So I committed my life. That's where it changed, to doing this work with Black women. And you're probably saying, she's supposed to be talking about maternal mortality. I promise you I will. And what you're going to find out is it's the same story. It's not different. Same thing that I'm talking about now with Black mamas dying. That's the same thing I was talking about and still talk about with Black women. Nothing's changed. I tell people, because we also do work around access to making sure that folk have access to abortions. And I tell people all the time, the same thing that bring folk to the clinic or where it is that I'm at to get an HIV test, Black women, that's the same thing that take them to abortion clinics. That's having sex without a barrier with an unintended consequence. That's all. You don't intend to get HIV. You don't intend to get pregnant with a pregnancy that you cannot carry full term right now. It's the same thing. And then we send them back home to the same situations. And then they come back. So I can continue to test women, but I keep sending her back to the same situation. Eventually, she's going to test positive. We can keep sending women back and forth to the abortion clinics if we want to, and we can keep saying that abortions are not birth control, but it is. But if we keep sending them back to the same situations, they're going to keep having to come back to the clinic because we're not fixing the thing that we're sending them back to. So with that, it is the same story, right? And so we started doing this stuff, and so I realized that, hey, so we were expecting women to be able to not get an HIV diagnosis because we want them to change their behavior, use a condom every time, do all this stuff. Well, how in the heck are I usually have a different audience too. How in the heck, I'm in Morehouse, so I gotta watch it. My grandson is thinking he might want to transfer and come, so I'm gonna watch my mouth. But how in the heck do we expect for people to change their behavior if we're not prepared to change the conditions that folk are living in? That's not going to happen. So in order to change behaviors, I say this all the time, I don't do work with black gay men. I wish I did sometimes, but I don't, because I just want to strangle people, because I want to say, doggone it, if you're not dealing with the situations that these men are living in, the behavior is not going to change. I'm happy that we have prep, and I'm not talking about men who sleep with men. That's not what I'm saying. That's not the behavior I'm talking about. I'm talking about survival stuff. I'm talking about survival stuff. I'm talking about folk getting kicked out of their homes. I'm talking about folk, all those kind of things. I'm talking about folks having to make decisions on how they're going to live so that they can live. That's all I'm talking about. And so how you think that's going to change if we're not doing anything about that, if we're not having the hard conversation? Because just like people struggle to use condoms, they're going to struggle to use PrEP too, because the situations haven't changed. So that's all I'm saying. So now I'm going to get on to mamas dying, black mamas dying, I guess. So a few years ago, when I didn't have any funding and I wasn't popular, because, money makes you popular. So a few years ago, when I was just running through the city with backpacks on, riding buses to places like Atlanta and all of that, so I could be in the company of the folk who had the money, so that perhaps I could get some of the knowledge and the information that they know, so that I could take it back to the folk who didn't have the money, who needed it the most. I got an email, and the email was from the Black Women's Roundtable, and the email gave a history on black women and how black women were faring after 50 years after the civil rights. And so, or was it 4 or 5 years after President Obama? But anyway, I read all of it, and what stuck out to me, it talked about all of the places that black women were excelling. We were going to college, we was getting different degrees, we were entrepreneurs, we were doing all of these things, but what was not happening, it was around our health. So black women were still dying, black women were getting sicker, all these things were happening. But the thing that really hit me, and mind you, I live in Texas, it said that black women were dying from childbirth at a rate of women in Lebanon. Now this was way before this, it's got popular now, everybody talking about it. But this was 5 years, this was like, so this has been probably, this is 2019, so this has probably been 10 years ago or something like that I read this, maybe 8 or 9 years ago. Again, I'm old and I can't remember all those dates. And I said, wow, nobody is talking, black women dying. And I said, well, I wonder what that looked like in Texas. And so with no funding, that next Texas legislative session, I took my little crew of volunteers and we created this little thing, and we did a state of black women in Texas, and we talked about maternal mortality, and we talked about that, and nobody acknowledged that. There was other things, but they didn't really acknowledge that. And then the next year, or was it the year before, Wendy Davis did this filibuster, and she was talking about abortion, about health care. It wasn't abortion necessarily, but it was about reproductive health care and some of the laws that was happening in Texas. They was about to close all of those clinics, right? And all of those clinics closed in Texas right after that, but a thing happened to me when she was talking, and I'm sometimes usually the only one in spaces in Texas, and y'all know what I mean when I say the only one, yeah. And so since I'm usually the only one, they called me and asked me if I would come to Austin and speak. And so I told them I would, because they needed one, but I got sick and I couldn't speak. And I was in the hotel room looking at this, and I said, well, they got all those orange T-shirts. They got all of that stuff. They got all this stuff happening. I don't see any black women. And so I made a commitment to Texas that I would come back 100% and I would do this work. And so that's what happened. And so in doing this, what we realized that is when they closed those clinics in Texas, not only did they close those clinics to prevent people from getting access to health care, reproductive health care, black women started dying. From maternal mortality started to become a thing, right? people started dying, and mostly it was black women. That was happening everywhere. I know Texas and Georgia had a little pissing contest for a while because Georgia was saying we got the most black mamas dying, and then Texas said, yeah, y'all did last year, but now we got the most black women dying, and so now we got the crown in Texas because we literally have the most black women dying because Georgia did something about theirs clearly, but they probably did what Texas did. They changed what maternal mortality looked like. So maternal mortality says within 45. So I didn't give y'all the definition. 45 days within a woman, either in pregnancy or 45 days after having a baby, that a mother dies from something that's not an accident or an incident. So that means that a car didn't run over her or somebody didn't shoot her and kill her. But with black women, that could also be a thing, somebody shoot her or kill her or whatever. And so 45 days don't make a lot of sense. Why do you say 45 days don't make a lot of sense? Because in a state like Texas, in a state like Georgia, people lose access to Medicaid after 42 days. And they start dying within 75 days, between 60 and 75 days. So then you don't have to capture those numbers, right? And so now you can say that the numbers are going down or not as many women are dying. You are lying. They are dying. They don't have access to health care. They're not being able to go to the clinic. Nobody is writing it. And then there are black women and nobody's listening to them. They're going to the doctors and they're saying that this stuff is happening to me, and people are sending them back home. The first woman that we worked with, her daughter had gone to the doctor between being 3 or 4 months, right before she had her baby and dying. She had gone to the emergency room 22 times. And they never put her in the hospital. And she kept telling them that she was sick. And as it turned out, guess what was wrong? She was sick. Now, of course, Texas says that she died. It was a sepsis infection. It probably was because there was still placenta. All they needed to do was massage her. And it would have moved and it would have passed. Or had she had a midwife, the midwife would have been able to look at the placenta and know that the placenta wasn't whole, and would have did the necessary work to dislodge that piece of placenta that was still there. And so, because she's a black mama, nobody was listening. So now you have this older woman who's having to take care of these twins that she left behind. And one of the babies is physically challenged. And this woman is having to take care of it because nobody listened to her daughter. That's just one story. We have our intern is here, and she has tons of stories that she's been taking over the last year. This is happening because people are not listening to black mamas. And so I said to you all, I'm going to be getting ready to go. I said to you guys in the beginning that almost they are the same stories. Here's the difference, though. All of the stuff that we've talked about earlier around social determinants of health, and we talk about poverty, we talk about all those things, and we talk about poor women at a greater risk of becoming HIV infected because they're homeless. There are all these things. Guess what? Then that's not the case with mamas dying. See, black women are dying no matter what their educational statuses are, no matter what their economic statuses are. Because you all had a woman right here from Atlanta who worked for the CDC a couple of years ago. She died. And she had many degrees. And she was working on this. Why is it that these social determinants impact black folks' lives so? And I think she started to work around coining this thing around weathering, and what that means after all these years of racism and how that impact our bodies. And she's dead. The Duchess know what's going on. She knows she black. She had a doula. Okay? It is because we are black. Now, it is not our blackness that's killing us. It is this society's response to our blackness that kill us. Because if that's not the case, Serena Williams should never have the issues that she had. She could have bought the hospital. But she was still black. See, they don't listen to us. We can't live our best lives if they're not listening to us. That's what y'all think was living a happy life. We can't live our best lives if they're not listening to us. And they don't listen to us. And we walk into these clinics and they are already there with their implicit biases. This is no different from HIV. We walk into the clinics and they say, yeah, who were you sleeping with? How many partners have you had? Why have you done this? Why are you sleeping with men? Why are you doing this? Why are you? This is not your business. Your business is to treat me. That's what you're supposed to do. Free of shame, stigma, implicit biases. That's what you're supposed to do. And that's what they're supposed to do with us as black women. So yes, we are dying, and the world don't care. And that's why we better care. And I'm going to tell you why I know they don't. And then in closing, so a couple of years, so this summer, I don't know, you guys may have heard about it. I hope that you didn't, because I try to go to places and not have to hear about that darn blasted billboard. So we had the audacity in Dallas to put up a billboard that said, abortions are self-care. We said it, we meant it. We're not taking it back. Because nobody gets to define for a woman what's self-care for her. And so we put it up there, but it was in response to something else that had happened, where this group of preachers decided that they would shame and embarrass and make black women and other brown women feel bad about choices that they had made. And they lied. They said abortions was not health care. And they are health care. It's a medical procedure. So we put the billboard up. It was just to reclaim a narrative and reframe a narrative, right? And so people, you got to know, because I saw y'all's faces. So you got to know what happened. It shut our organization down for about 2 weeks. And they didn't shut us down. We just had to answer them phone calls. we had to answer them phone calls because it was serious. We endured it because I'm still standing here. So I talked to a person, a news person, and so they went on to talk. And I'm going somewhere that they don't care about us like they want to make you think that they do. And so she said she didn't know about us and all this. I said, well, I'm surprised you didn't know about us. I said, because we did the same campaign last year. She said, really? I said, yeah, and we sent you an invite to a press conference. She said, really? I said, yeah. She said, this same campaign. I said, well, it was those same black women. And she said, really? I didn't notice it. I said, I know you didn't, because we were talking about maternal mortality. We was talking about black women were dying. That's what we were talking about. And y'all don't care about black women. Because if you cared, you would have seen that campaign. What you do care about is controlling us. What you do care about is controlling how we live, who we sleep with, what happens when they do that. That's what you care about. You care about our reproductive freedoms. You care about the fact that when it is to your benefit we need to have babies, when it is not to your benefit we need to stop having them. You care about trying to tell us who we are and how we get to be there. That's what you care about. But you don't care about black women's lives. I haven't seen that, and I told her, I said, I haven't seen not a one of y'all in this city protest when young black trans women are being killed. Don't tell me that you care about black women's lives. Don't tell me that, because you don't. As a matter of fact, you want to shut it down. So when you want to have those kind of conversations with me, I'll sit down and talk to you. But until then, you just keep reading our billboards, because they're going to keep coming. And you just keep watching us, because we're not going anywhere. So the Afiya Center, so that's none of that stuff I wrote down. I'm sorry. I had a really nice thing here wrote down to talk to y'all about. Really, really good. And it was succinct, and everything was right there, including some data. But I'm not a data person, so thankful when you get funded, you get to get people to do that. So Allison is out there. She can tell y'all anything you want to know about the numbers, if you ask her. And we have a really amazing policy person at the office who put all this stuff together, and I get to do the fun stuff like this. And so, yeah, we can live our best life. We can do all of that, but we can't do it. We have to make sure that when we go into the hospitals, when we go into clinics, that the doctors or whomever the care team, that they're listening to us. And if they're not listening to us, you can get another doctor who will listen to you. You know, we have to make sure, as a black mother, I'm literally closing with this, I am a black mother. I have 2 daughters who are of childbearing age. I'm not extremely excited for them to get pregnant, because I'm not really sure how that's going to play out. I want to make sure, even though I want to have some more grandchildren, I'm a mother before I'm a grandmother, and I don't want to have to be a grandmother that's now got to mother. That's not the rest part of my life. That's not my plan, is to have to raise my grandchildren. And so many of us as black mothers, so we are not only concerned that our boys and our girls are not killed by policemen when they are out on the streets, or people who think that they're a policeman. Now we got to make sure that when our daughters or our people, because everybody having babies don't identify as women. So when our people are going to the hospital and having babies, that they get to come home and stay home and raise those babies. That's what we got to be concerned about. So I don't want to bring everybody down. I want us to be up, because we can't win this thing. Black women across the country are fighting hard. If you don't, I mean, yeah, Black Mamas Matter was started right here in Atlanta at Sister Love, Sister Song, at the Mother House. Black Mamas Matter was started right there. They are doing amazing work. The Afiya Center is a part of Black Mamas Matter. We are working tenaciously across this country to make sure that Black mamas are mattering, that Black women are no longer dying when they have babies, that this is over, and that they are prioritizing Black women in the medical profession and everywhere else. We are working to decolonize birth, to make sure that folk have access to doulas and midwives and home births and whatever that look like for you. The midwives that we are talking to, I've met midwives who've been doing midwifery for 20 years and never lost a mama or a baby. And so we do know that it'll work. Many of us probably had midwives, they just didn't call them that. And so we know that it'll work. And so take this information. This is a medical school. We're working to see midwifery schools on historically Black college campuses. That's one of the things that we're working to see. So let's talk about it. Let's keep the conversation going. We can be our greatest. We can live our greatest life. We can live our best life, but we got to do it as a collective and as a collection. So thank y'all.
Listening to Black mothers, and how appropriate as we're coming up to the weekend where it is Mother's Day. And I see that we do have a question. You ran off before. So you had a question or a comment?
Dr. Spence Lewis, thank you so much for the presentation. It's so appropriate. And this is a global problem. It's in Africa, all throughout Africa, Black mothers are dying for the same reasons that they're dying in the United States. And so apropos what she said about midwives and doulas, because my grandmother was a midwife, and she, and my mother was a nurse, and they both saved me because I'm rhesus negative, which in those days you tend to abort. Mm-hmm. So abortion must be spoken about, just as you say, and many people don't understand. There are clinical abortions, and we have to understand that. And in closing, we must educate our children, not just female children, but male children, as early as possible in our homes before they go to school, right. So they will have a consciousness about the responsibilities of raising a live, of having a live birth and a live, healthy mother. So that's so appropriate. And I know, God bless them, they're both in heaven now. But if it wasn't for my grandmother, I'd be 6 feet under, because I was in bed 8 months because I was hemorrhaging slightly. And so that's what saved me. So it's so important to have a female around you that understands the implications of your health. They do not discuss that in medical school. They do not discuss it at all. They think that's just a female prerogative, and that women and the other conditions, young people are not educated about that in a preventive way. Thank you very much.
Well, thank you for your comments.
We are going to Malawi next year. We train doulas at the Afiya Center, so we now have a doula collective, and I'll be going to school to be a midwife. And so we are going to Malawi next year. I don't know how long we're going to stay yet, but we'll be going, myself and one of our board members who also did the training, and that's her country, and we'll be going to train, do midwifery training, doula training and birthing training.
Yes, with respect to what you say about...
Excuse me 1 second. Can we just have further conversation? Because Marsha will be here. Sorry to cut you off, but we have just one more brief remarks before we go to lunch, and there will be opportunities more, okay? As Marsha was talking, she made a statement about the billboard. She said that they said it, they meant it, and they weren't going to take it back. I remember when I was growing up, we had a little saying that we said it, we meant it, we stepped back in it, which meant the same thing. You're not going to take it back. So thank you, Marsha, so much. Let's give her another round of applause.